Alrighty. Okay. You guys should be able to see this now, hopefully. Sorry, guys, it's taking forever to load. Okay, so if we can go ahead and join. Go ahead and see if you can turn your camera on, please. Thank you. Okay, those of you guys who are just joining, if you can turn your cameras on, and then we're going to do a Kahoots for the Hesi review portion. I had checked with everyone else that they had signed up for their Hesi time frame for next week. Have you all been able to do that? Yeah. Okay. And then on Sunday, the 13th at 2 p.m. Eastern, Professor Bogart is doing a Hesi review and Q&A session. So others have really found that helpful in the past. So if you can join that, I'd highly recommend that you join. Okay. Week 12, we will have class on Monday the 22nd from 2 to 2:30 Eastern. We'll just go over a few of the concepts that you guys missed most on the Hesi, okay? It's Sunday the 13th. Right? Isn't that
The Saturday is actually the 13th.
Okay, let me see.
I was just about to say that Saturday.
Okay.
Yeah, because I was about to say I got it wrote it on Saturday.
Yep,
at
you're
2.
right. Sorry. Yep, Saturday at 2. I had my dates off. Saturday at 2 Eastern. Okay. Let's go ahead and get
What
started.
time did you say that we'll be meeting on the 22nd?
From 2 to 2:30 Eastern. Okay, a toddler swallows grandma's digoxin. What should you anticipate? Have the child vomit immediately, have digoxin, Huminifab, or Digibind ready, eat a banana, take the child's pulse. Yep, good. Have Digibind ready. Okay. To counteract the dig. Good. Okay, multiple select. Signs of respiratory distress in infants. Restlessness, flaring nostrils, grunting, bradycardia. Good. Restlessness, flaring nostrils, and grunting. What would it be instead of bradycardia? What would their heart rate do?
Tacky.
Yep, good. When a pediatric patient has an amputation, what priority teaching is very important? Inspect the stump for skin breakdown to prevent infection, keep the stump open to air, wash the stump with betadine, or range of motion exercises. Yes, good. Inspect the stump for skin breakdown to prevent infection. Perfect. Okay, multiple select. What is acute myelocytic leukemia, AML, in children, and what are the symptoms? Anemia, frequent infections, bone and joint pain, bruising. Yep, good. All of those are potential symptoms. Anemia, frequent infections, bone and joint pain, bruising. Okay, good. Multiple select. What may be a problem seen after surgery for tetralogy of Fallot? Low heart rate, poor appetite, fatigue, respiratory distress because of congestive heart failure. So, poor appetite, respiratory distress, fatigue, and what would you see the heart rate do? Potentially. Tachy. Okay. Tachycardia. Okay. Good. Multiple select. What are the defects associated with tetralogy of Fallot? Pulmonary tract obstruction, right ventricular hypertrophy, VSD, aortic stenosis. Yep, so pulmonary tract obstruction, remember that pulmonic stenosis that you see, right ventricular hypertrophy, and a VSD. I will just tell you guys, Hesi, NCLEX, all of that really like to ask about tetralogy of Fallot because there's so many defects within it, okay? So really no tetralogy of Fallot. Okay? Good. An 18-year-old parents want lab results. Do not give out as against hospital policy. Get permission from the 18-year-old. Get written permission. You may give the parents the information. Okay, so if the 18-year-old gives you permission to release the labs, then you can release the labs. Otherwise, you cannot. Okay. Best to have written permission, but if they give you a verbal, that's okay too. Okay, what is Synagis and why is it given? Closes the PDA, RSV vaccine, antibiotic, or growth hormone. Okay, Synagist, palsaminabab, that's the RSV vaccine. Okay. So that's the monoclonal antibodies to RSV. Good. What is it that closes the PDA? A few of you guys chose that. We'll talk about that after. What is the highest priority for a pre-op infant with bladder exstrophy? Yep, you're concerned about infection with bladder exstrophy because their bladder is exposed outside of their abdominal cavity. Okay. All right. What closes the PDA? What medication? Oh, someone chatted me in. Indomethacin. That's correct. Good. Okay, a 10-year-old wants an insulin pump for type 1 diabetes. Not a good option, not available until they're 18. A good option for a 10-year-old, or only adults get insulin pumps. Yep, good. 10-year-old for an insulin pump, that's an okay option. Okay, good. Okay, multiple select. When and why would a Lyme test be done on a child? To detect tick bites, a blood test to detect Borrelia burgdorferi. Testing is done within 1 to 2 weeks after exposure, or to detect gastroenteritis. Yep, good. To detect tick bites. It's a blood test to detect Borrelia burgdorferi. That's the other term for Lyme. Okay. And it's done 1 to 2 weeks after exposure. Good. What might you see after administering a bolus of albumin to a child? Noisy respirations, constipation, increased urinary output, or peripheral edema. Yes, good. You're going to have increased urinary output. Good. Multiple select. What is another term for erythema infectiosum? Fifth disease, slapped face, measles, chickenpox. Yep, so fifth disease or slapped cheek or slapped face, you'll see. Okay. Good. What is the treatment for pertussis? Ibuprofen, zithromax, acetaminophen, diphenhydramine. Yep, good. Zithromax, azithromycin has to be treated with an antibiotic and a broad spectrum antibiotic, okay? Good. How do you get rid of cradle cap on the infant? Scrub with soap and water and brush head with a hard brush. Comb hair vigorously. Use mineral oil to moisten and a fine tooth comb gently. Wash baby shampoo and massage scalp. Yep, good. Use the mineral oil. Okay, good. Post-operative abdominal surgery child has an elevated heart rate and respiratory rate. What assessment might you make? Child is playing too hard, child is having a temper tantrum, the child is tired, or the child is having pain. Yep, good. Child's having pain. What can cause rheumatic fever? Vomiting, diarrhea, strep throat, UTI. Strep throat causes rheumatic fever. Okay. Good. An adolescent girl wants information regarding birth control. What does the nurse do? Give her written and oral information. Have her speak with the parents. Tell her you cannot discuss this. Tell her she should not be having sex. Yep, good. Give her written and oral information regarding birth control. Good. Multiple select. How can you control GERD in an infant? burp frequently, add rice cereal to the formula, keep head elevated for 30 minutes to 1 hour after feeding, place the in prone in the crib. Good. Burp frequently, add rice cereal, and keep the head of bed elevated. Good. Multiple select. 15-month-old brings a spoon upside down to their mouth. The mother asks, "Is this normal?" Ask the mother why she is concerned. This is normal. The child should be referred to a neurologist. The child is experimenting with the food, the spoon. Yep. Ask the mom why she's concerned because this is considered normal. Okay. And then the child's just experimenting with utilizing a spoon. Good. Multiple select. How is JIA treated? NSAIDs, steroids, methotrexate, Synagist. Good. What's in common with NSAIDs, steroids, and methotrexate? What all do they do?
They help the inflammation.
Yeah, reduce inflammation. Good. Toddler has vomited 2 times and is listless and irritable. What do you tell the mother on the phone? Try to give Pedialyte. Do not feed the child for 4 hours. Then take the child to the ER. Give the child their favorite food to eat. Okay. They're listless and they're irritable. So what does listless mean?
Would that be
Like they lack
lethargic?
energy.
Sorry, you guys were talking at the same time.
They lack
Would it be-
energy.
Lack energy or
Lethargic.
yeah, so they're like almost like a step above unresponsive, essentially. Okay. So you wouldn't want to try to have them ingest anything at that stage. So if a kiddo's listless and the mom's calling you and telling you that they're listless and they're extremely irritable, you would not want to encourage that mom to give them Pedialyte, okay? You would want them to take them to the emergency room to be evaluated. Good. Okay, an adolescent status post-amputation for osteosarcoma is angry and blaming their parents. This is a normal reaction to cope with the loss. The child needs to go to a psychiatrist, not a normal reaction, or it is the parent's fault. Yep, a part of the coping process. So this is a normal reaction, okay? Good. Multiple select. What should the nurse assess for a child with hypo and hyperpituitarism? Abdominal girth, head circumference, height, weight. Okay, height and weight. Hyperpituitarism and hypopituitarism affects their growth overall. Okay. So abdominal girth is not going to be something that's overly concerning. Head circumference, same thing. But height and weight is what you're most concerned about. Good. Multiple select. An infant with tracheoesophageal fistula, what should the nurse have at the bedside? Tube feeding and supplies, Foley catheter, suction equipment, or the head of bed elevated? So, tube feeding and supplies. Should we feed a kiddo with TEF? No. Nope. Okay. So, suctioning equipment and the head of bed elevated is what you need, okay? Good. No feeding the kiddo with TEF till it's fixed. Good. Okay, a child has been having diarrhea for 3 days. What should the nurse check? Respiratory rate, pulse rate, abdominal circumference, temperature. Pulse rate. Why would you care about the pulse rate the most? What's that going to tell you?
If they're dehydrated,
Perfect. And what would tell you that they're dehydrated? Would it be bradycardia or tachycardia?
Tachycardia.
Tachycardia. Yep, exactly. Good. Okay, another multiple selects. What is a VP shunt used for? To connect vessels in the heart, to drain the peritoneum, to drain the fluid from the head into the peritoneum, to relieve the pressure of hydrocephalus. Yes, so to drain the fluid in the ventricles from to the peritoneum, and then to also relieve the pressure of the hydrocephalus. Good. What would you see with a child with autism? Tying shoes, reading a book, repetitive behaviors, playing with other children. Repetitive behaviors. That's what you would see. Good. Multiple select. A mother of a child diagnosed with Duchenne's muscular dystrophy wants more children. Have her ask her doctor, recommend genetic testing, X-linked recessive trait or a Y-linked dominant trait. Good. Yep, recommend genetic testing and it's X-linked recessive, which means what?
It's carried by the mother.
Yep, and then who's more likely?
Males.
Yep, exactly. Males are more likely to have it and be affected. Good. Okay, multiple selects. An umbilical hernia has become hard and painful. What should the parent do when called? make the child NPO, give the child pain medication, send to the pediatric emergency room right away, measure abdominal girth. Yep, make them NPO. You don't want to give them pain medicine before they're probably going to have surgery, right? Nothing by mouth. If a hernia becomes hard and painful, it has a risk of becoming incarcerated, right? So whatever's protruding through that hernia has the risk of dying. That tissue has the risk of dying. So they have to have surgery right away to correct it. Okay, so you don't want to feed them. You don't want to give them any medication. Okay. We don't really care about them measuring abdominal girth. We want them to be seen right away. Okay, good. What acid-base imbalance is caused by hyperventilating? Respiratory alkalosis, respiratory acidosis, metabolic alkalosis, or metabolic acidosis? Respiratory alkalosis. Yep. Good. And it's respiratory because they're it's hyperventilation. So if the lungs are what is causing the problem, then it's always going to be respiratory. If it's anything else that's causing the acid-base imbalance, it's going to be metabolic. Okay. Multiple select. Child has fallen and a stick is scratched into their eye. What should you tell them to do? Pull out any debris from the eye, send to pediatric ophthalmologist, place a Fox shield over the eye, or send to the ER. Fox shield, send to the ER, have them see pediatric ophthalmology. Okay. Good. Don't pull anything out from their eye. An infant arriving in the ER is congested, febrile, has a cap refill of less than 2. What should the nurse do? Lay the infant supine, limit oral intake, encourage the child to play, keep the child isolated from others. Yep, so you're going to keep them isolated, okay, because they're febrile and congested, so they likely have some viral illness that's causing their problems, okay? Good. You don't want to restrict fluid intake unless you have an absolute reason why you have to do that, okay? School-age child has recurring dermatitis or eczema. What suggestion would a school nurse provide to the parents? Consider homeschooling, ensure lunches are hypoallergenic, keep the child home during dermatitis flare-ups, encourage the child to wear cotton gloves. So actually keeping them home during flare-ups is beneficial because what can happen? If they have a flare-up of their atopic dermatitis or their eczema, what would they be prone to getting? I can see your guys' mouths moving, but
Infection.
yeah, infection. Yep, good. Perfect. Okay, multiple select. Why do you give aspirin to a child with Kawasaki's? Pain relief, anti-inflammatory, preventing clots, thinning blood. Perfect. It works as an anti-inflammatory, it prevents clots, and it thins the blood. That's your goal for Kawasaki's. You are not giving the aspirin for pain relief. Okay. And do we give aspirin for like any other condition other than Kawasaki's or sometimes in rare cases cardiac conditions? No.
No.
Okay. What do we worry about if we're giving aspirin to children? Rise syndrome. Yep, exactly. Perfect. How do you medically close a PDA or patent ductus arteriosus? Prostaglandin, indomethacin, Synagist, furosemide. We'll see who was paying attention earlier. Yep, good. Indomethacin. Indomethacin is what you give for closing a PDA. Good. Child's post-tonsillectomy is swallowing every 2 minutes. What do you do? Offer warm fluids, inspect the oral pharynx, ice collar, pain medication. Yep, you're going to inspect their oral pharynx. Why would that be your best choice?
Bleeding.
Yeah, because you're concerned that they're bleeding. Good. Also, to go back to the last question, we talked about what closes a PDA, but what keeps it open? What do they give to keep it open in case they have a defect that they have to keep it open for good oxygenation? Do we remember?
Prostaglandin.
Prostaglandin. Yep. Good. Child is walking on their tiptoes all of the time. Ask the child why they do this. Refer to a neurologist. This is normal. Ask the child to walk on their feet. Okay, you're referring to neurologist because it is not normal that they're tippy-toeing all the time. Okay. What are you concerned about if they are tippy-toeing all the time? What potentially?
Autism.
Uh-huh. Exactly. Good. Multiple select. What treatment should a child in pain with JIA have? NSAIDs, hot baths, cool baths, distractions. Yep, good. All of those things could be helpful for pain. NSAIDs, hot baths, cool baths, distractions. Okay. And infants' sweat tastes salty. Give the baby a bath, test them for CF, check electrolytes, give the infant a nap. Yep, good. Test them for cystic fibrosis. Okay, good. Multiple select. How do you diagnose hip dysplasia in an infant? Positive Ortolani maneuver. Affected leg is shorter than the other. Asymmetric folds in the buttock. Or foot points inward. Yep, so positive Ortolani maneuver. The affected leg is shorter than the other, and then asymmetrical folds. Good. What causes acute glomerular nephritis? Recent strep infection, poor oral intake, kidney injury, or UTI? Yep, good. Recent strep infection. And usually, what do the patients not do?
Complete the antibiotic.
Yep, exactly. Good. Multiple select. What may be a problem seen after surgery for tetralogy of flow? Fatigues quickly, respiratory distress, poor appetite, constipation. Yep, fatigues quickly, respiratory distress, and poor appetite. Constipation is not something that you commonly see after tetralogy of flow. Okay. Good. Multiple select. Child with pertussis is receiving azithromycin IV. Your priority to include in this child's plan of care. Assess for abdominal pain and vomiting. Monitor vital signs with facial swelling and urticaria. Obtain vital signs at onset of fluid overload. Change the IV site dressing every 3 days and PRN. Yes, good. Monitor for abdominal pain and vomiting. Okay, because IV Zithromax is pretty tough on the belly. And then, of course, monitor for facial signs and then urticaria. What's the other term for urticaria? Anybody? Not sure? Hives. Okay. Hives. Urticaria or hives. Okay. Good. Okay. Why do sickle cell patients have enuresis? Sickling children are overhydrated, loss of urine control, sickle crisis in the kidney, regression. Yes. So remember, with kids with sickle cell, we're keeping them overly hydrated, right? So hopefully they don't have a sickle cell crisis. So kids who have sickle cell, because they're being overhydrated, a lot of times it's not uncommon to see some urinary accidents or enuresis. Okay. Good. Infant is scheduled for cleft lip repair. What information is priority to convey to the surgeon before surgery? Weight gain of 2 pounds since birth, urine spec grab of 10, 11, red blood cell count of 2.3 million, white blood cell count of 10,000. Yeah, red blood cell count of 2.3 million, because is that low or high? Really low, right? A 2.3 for a red blood cell is really low. So you would be concerned about what if that kiddo has surgery? If they're already anemic and they have surgery, what would be the
Bleeding.
risk? Yes. Bleeding worse. Good. Losing more blood. Good. When administering indomethacin to an infant who has patent ductus arteriosus, anticipate which outcome? Increased respiratory effort, increased number of red blood cells, decreased urinary output, decreased cardiac murmur. Yep, good. After you give them indomethacin, they're going to have a decreased cardiac murmur. Good. When should solid foods be introduced to an infant? 2 months, 6 months, 8 months, 1 year. Yep, good. 6 months. Okay, I'm going to stop sharing my screen and I'm going to upload the other Hesi. Are you good with doing another Hesi for the next 20 minutes? We'll leave 10 minutes early since we were all done about 10 minutes early from the exam. And I'm not sure if we'll do exam review or like the item analysis on Friday this week or Saturday. But for sure by Saturday afternoon, you guys should have all of your exam grades in there. In this week's announcements, I put all of your Kahoots from the prior 9 weeks there, all on one paper for you guys to have access to. That might be helpful for reviewing. And then also the 2 big Hesi Kahoot questions, as well as the PowerPoint. If for some reason you guys can't get into any of those things, let me know. Sorry, Kahoot is loading. Maybe Cahoots will load. Okay. We'll do this for about 15 minutes. Okay, we'll go ahead and get started. What is probably the single most important influence on growth at all stages of development? Culture, hereditary, environment, nutrition. Yep, nutrition. Okay. Because if people aren't getting the appropriate nutrition that they need, then they're not going to be growing and developing like they should. Okay. So nutrition is the most important influence on growth and development. Good. How would you initially treat a 6-month-old diagnosed with GERD? Offer water between feeds, decrease the amount of milk every feeding, start Rananidine, add rice cereal to formula. Yep, first you're going to add rice cereal. Okay, good. During the assessment of a 2-month-old, you notice that the head circumference has increased over 2 inches. Next action to take. Remeasure 2 more times, monitor for vomiting, check fontanelle for bulging, check pupils. Yep, good. Check fontanelle for bulging. What would you be concerned about? What do you think's going on with this kiddo?
Increase ICP.
Okay, but what condition?
Hydrocephalus.
Hydro.
Yes.
Yeah.
Yep, perfect. Frequent developmental assessments are important for which reason? Infants need stimulation specific to a stage of development. Critical periods of development occur during childhood. Stable developmental periods can identify delays or deficits. Child development is unpredictable and needs monitoring. Yes, good. Stable developmental periods can identify potential delays or deficits. Good. Multiple select. An infant just received their 2-month set of immunizations. Discharge teaching should include give Tylenol as directed for injection pain site or fever. Apply cool pack to the leg for discomfort. If an infant has fever, call healthcare provider immediately. Pedal legs, pedal, legs, my goodness, to help with inflammation. Yep. So yeah, encourage use of the legs. That'll help with any inflammation in the muscles that they're given. Okay. So by pedaling their legs or moving their legs around, that's helpful. Cool pack, and then giving Tylenol. Okay. Could you give them Motrin at 2 months? No. 6 months. Okay. No Motrin until 6 months. Good. Head to tail direction of growth is referred to as sequential, proximodistal, cephalocaudal, mass to specific. Cephalocaudal. Okay. Head, cephalo, ceph is head, caudal is tail. Cephalocaudal. Okay. Good. What is the single most important factor to consider when communicating with children? The child's physical condition, the child's developmental level, the presence or absence of the child's parent, the child's nonverbal behaviors. Developmental level of the child. Good. Two-year-old, what pain assessment would you use for a 2-year-old? Faces pain rating scale, Oucher scale, numeric scale, FLAC tool. FLAC. What age can you use faces? This was tricking you guys. At
Isn't it
age
6?
3. At age 3.
3.
Yep. 3 and up, they can do faces. But less than 3, FLAC. Good. Child requires ophthalmic ointment to be applied to the eyes. What teaching should the nurse give? Clean the eye from the outer corner to the inner corner of the eye. Warm medicine before application. Medicine will make vision blurry. Use cotton balls to clean the eyes. Yep. It will make your vision blurry initially, okay? What way should you clean? Inner corner to outer corner. Okay, good. According to Erickson, school-age children having prolonged hospitalization should be offered what to promote industry. Be challenged with harder physical tasks. Offer tasks that give the child a sense of accomplishment. Keep the child in touch with their friends and family. Involve child life to play games with the child. Yep. Offer them tasks to give them a sense of accomplishment. Good. What is your priority treatment for a child with dehydration due to profuse vomiting? IV fluids, administer oral electrolytes, maintain NPO for 6 hours, restrict fluids. IV fluids, okay? If they have profuse vomiting and they can't keep anything down, then you need to do IV fluids. Good. The first expected fine motor developmental milestone for an infant begins with what? Voluntary palmar grasp, neat pincer grasp, puts objects in a container, reflex palmar grasp. Reflex palmar grasp. Okay. They have the reflex first. So parent puts their finger in their palm of their hand and they're going to automatically, the reflex is going to be to grab their finger. Okay. Doesn't become voluntary until later. Good. An 8-month-old infant should expect to perform which fine motor skills? Try building a 2-block tower and grasp a rattle by hand. Use pincer grasp and place objects into container. Place objects into a container and walk with one hand held. Grasp a rattle by hand and uses crude pincer grasp. So holding onto a rattle, okay, and crude pincer grasp. What's the difference between fine pincer grasp and crude pincer grasp? Do we remember? Crude is when they're using like their whole hand essentially, or all their fingers to try and sweep to hold on to it when they're grabbing something. And fine is pointer, finger, and thumb. Okay. They have to have crude before they have fine. Okay. Good. In general, an infant should triple their birth weight at what months of age? 8, 18, 12, 24. Yep, 12 months of age. Okay. Triple their birth weight by 12 months of age. And double by when?
Six months.
Yep, double their birth weight by 6 months. Triple by a year. Good. An RN assessing a 2.5-year-old toddler should report which finding to the provider? Height increased by 3 inches in the past year. Head circumference exceeds the chest circumference. Anterior and posterior fontanelles are closed. Current weight equals 4 times birth weight. Okay. Head is bigger than their chest. By toddlerhood, their chest should be bigger than their head. Okay. If their head is bigger than their chest, then you're concerned. Mother of a 3-month-old infant is concerned because the infant's head is flat in the back. What's your response? Turn to either side when sleeping, position on the abdomen when wide awake, place in sitting in a carrier while awake, use the soft smell pillow for their head. Position them on their abdomen. Do tummy time, okay, when they're awake. What is the flat spot on the back of the head? What's the term for that? Do we remember? Plagiocephaly. Okay. Good. Okay, a 2-month-old infant has cradle cap. What should the nurse tell the parents to treat it? Wash with soap and softly brush hair with fine comb. Do nothing, it will go away. Wash hair only once a week. Use only soap and water. Yep, wash with soap and softly brush the hair with a fine comb. What else can they use on it?
Mineral oil.
Mineral oil. Yep, good. Okay, we'll do one more question. What information about introducing solids to their 6-month-old would you offer? Introduce one at a time every 4 to 5 day or 4 to 7 day intervals. Place the food with formula in a bottle. Fruits and vegetables can be introduced together. Solid food can be introduced at 12 months. Yep, introduce one at a time every 4 to 7 days. Good. All right, does anyone want to keep going? No?
No.
You're all overwhelmed. Okay. If you guys need anything else from me, let me know. Otherwise, good job.